So our presentation is on chapter 10, and it's about understanding drug side effects and interactions that they have on your body. Our consumer clipboard was about side effects of drugs, and the book gives the definition that side effects are undesirable or unexpected secondary effect of a particular drug, whether prescription or over the counter. There are two types of medications that you can take, and they're over the counter, which are bought at drugstores or even like a Target or Walmart, and then prescription medication, which has to be prescribed from a doctor. Both have different side effects. Some are common and some are severe. Most side effects could be just something as nausea or a headache, which are easy to deal with. And most of the time, those side effects go away as the medicine gets into your body more. And then there could be more severe side effects like bleeding or shortness of breath, which you have to usually stop medication and get professional help to make sure that you're okay on that medication and to continue taking it or not. It's important to know side effects because, like I said, you may need to seek medical help. So if it ends up being too severe, then usually you have to stop the medication. So knowing the side effects beforehand make it easy for you to distinguish whether or not it's normal or not what you're experiencing. Every medication, whether it's prescribed or over the counter, has a drug label on the back. It's required by the FDA, and it has information such as like the dosage you're supposed to use, the side effects you may endure, and then like how much to use during the day. For instance, I've posted like the Tylenol here, and it shows you that you are not supposed to exceed like 4,000 milligrams a day or could end up hurting your liver. So you want to make sure that you only take it every 4 to 6 hours like it says. A lot of prescription medication will tell you like to take it twice a day for 7 days. Another important reason why to know side effects is because some medications, such as like pain meds or sleeping medication, have side effects that can become more of an addiction, and it becomes drug abuse at that point because you're using medication for the wrong reasons. Like pain pills could be used for like numbness of the body, which when you are in pain is a good thing, but when you become addicted to it, it could become obviously not good for you. So it's just important to understand what the side effects are and whether or not you can handle them, and if you need to seek help if you cannot handle them. And
Now, as to what Conley said, it's very important to follow the labels of any type of medication, because if you don't follow them, it's very likely that you can fall signs to addiction. And if you do, unfortunately fall yourself into addiction, here's some methods to address signs of addiction. An example would be changes in mood that you could be experiencing that you normally wouldn't. Let's say something like having a rock in your shoe. Normally, for some people, right, you wouldn't be so distracting, but when you're addicted, you could find it really irritating and you just want to take it out right then and there. Another one would be having physical pains, often in areas that wouldn't or being more addressing to minor unpleasant feelings. And also lack of emotion and activities that you normally that would normally make you happy or be positive. And if you are prescribed a drug, consult with a doctor with any questions of its use and how it should be cared for, because doctors have been brought to the authorities involuntarily because their patients were being reckless, not asking questions on the drugs they were prescribed, leading to their death and leaving the doctor to blame. With the day and age we live in now, drugs like Adderall and OxyContin have been used so much it's seen as common in society, thus putting the impression on the public that these drugs have no consequences, thus leading a path to substance abuse. And since these drugs are commonly easy to obtain from doctors, exposure to them come from family and friends. Most cases, they get them prescribed from doctors and not from illegal vendors or other friends. And you're more likely to be exposed to these drugs from friends than from a doctor.
All right. So I found 3 peer-reviewed articles, and the first one I found was the prevention of drug and alcohol abuse, like what works. And the article stated that there is no single best option to prevent substance abuse, that it all comes down to knowing our communities, getting healthcare professionals in the areas of need, and just like and finding the best option for a single person. And one quote I found that was actually like pretty stood out to me was we must become as effective at marketing drug prevention programs as drug dealers are at promoting and selling drugs. And I mean, it's true. Like, when was the last time you really saw an ad for like rehabilitation or for drug prevention? Like, it's been a while since like I personally have seen that on TV or on the internet. And since we're on the topic of, drug prevention and addiction, one crisis that's going on right now that one of the articles I found was about the opioid crisis. And I found that contributors of the crisis were actually not drug dealers. It's like Irving said, they were doctors, physicists who campaigned opioids to treat pain. And many physicists were actually not educated on the dangers of opioid abuse. And like now we see the toll of that. So it's really important to make sure what your physicist or what your doctor's prescribing you, and make sure you know everything about what you are getting. And also, like Irving said, make sure do not accept pills from friends or family. And one thing I found too that recently, that one of the big companies for Purdue Pharma actually pleaded guilty to the opioid crisis, or to 3 charges from this crisis. So let's say one thing, or one other article I found was diverse drug reactions. Um, it just basically states like, oh, make sure you tell your doctor what you're allergic to or not. Make sure what's in your pills before you get them. One way you could find out what you're allergic to is they do skin testing. So they just put random like ingredients on your skin to see if you have an allergic reaction. And I know one thing is I think if I remember, I'm allergic to penicillin, so I have to avoid carbapenems. It's an ingredient that's used in bacterial infections. So make sure you know what is in the pills you are receiving.
So I found 2 authoritative websites that go along with this topic. The first is by the FDA. The U.S. Food and Drug Administration provides ways that consumers can reduce their risk of unwanted side effects when taking new drugs. These recommendations include asking your healthcare professional about any possible side effects and what, if any, steps should be taken to reduce the risk when you are prescribed a drug. Asking your pharmacist for the patient prescribing information when you receive your prescription, and reading the pharmacy label and any stickers that may be attached to the prescription bottle. The second article that I found was by familywise.org, and this page gives some very useful insight as to what the different types of side effects are, as well as how to manage them. Websites like these can be really beneficial in preventing addiction or the misuse of medication, and also just knowing what you're putting into your body. So we hope that you learned something new and enjoyed our presentation. Thank you for listening.